Joe, sports chiropractor and clinic director here at Full Function Rehab. Today we're going to be talking about concussions and what are concussions. So, what a concussion is, it's termed as a mild traumatic brain injury. And why it's stated as mild is because usually, in most cases, there's no real damage that occurs to the brain. What happens is that the brain is housed within our cranium, which is our skull. And during an injury, the brain bangs around within our skull and leads to injury and more of a neurochemical response. So the neurochemical response is changes in electrolytes, different sodium, potassium, things like that start shifting in the brain. We get stretching of the neurons and the axons, which triggers symptoms and triggers dysfunction. A lot of the times, or most cases, there's no real damage that occurs to the brain, but a concussion is still diagnosed. Advanced imaging, CT scans with most concussions do not show anything. This is a normal occurrence. Also, loss of consciousness does not also mean that it was a significant or non-significant concussion. You could typically have no loss of consciousness and still have a pretty bad concussion. So it all depends on the severity of your injury and the symptoms that you are presenting with. On a most extreme case, when there does require advanced imaging, is when we see that there's brain bleeding or microscopic changes to the brain where the axons or the nerves stretch and tear within the brain. You could get a release or discharge of what's called cerebral spinal fluid, which is a fluid encasing our brain in our cranium, and it could leak out of your nose, sometimes out of your ears, depending on the significance and the severity of your concussion. So concussions may be diagnosed as mild, moderate, or severe based on your presentation, based on your symptoms and your injury. Concussions usually occur either through sports, but we do see them through car accidents, forceful hits, or anything to the body which could cause the brain to shake. Slip and falls injuries, anytime you can damage or disrupt the function of your body by shaking the neck or the brain or hitting your head may result in a concussion. There's a lot of signs and symptoms that give us an idea of how severe it is, and how long they usually last is based on so many parameters: age, gender, the amount of concussions that you had, the severity of your injury. In our practice, we've seen patients that have been 2 weeks and they're good. Other times it's taken a year or longer, depending on the severity. And this is when we start getting into post-concussion syndromes, which is when we see long-lasting symptoms. But we'll leave that topic for another video. So this video is just to give you a more basic information as to what concussions are and how they may occur. Please stay tuned to our following videos where we're going to break down the concussion process, talk about some signs, symptoms, and we're going to get into the rehab protocols that have been shown in research to advance somebody's healing rate and increase their level of function. Thank you. Stay tuned to our next video.